Black Girls Podcast, a weekly conversation about mental health, personal development, and all the small decisions we can make to become the best possible versions of ourselves. I'm your host, Dr. Joy Harden Bradford, a licensed psychologist in Atlanta, Georgia. For more information or to find a therapist in your area, visit our website at therapyforblackgirls.com. While I hope you love listening to and learning from the podcast, it is not meant to be a substitute for a relationship with a licensed mental health professional. Hey y'all, thanks so much for joining me for session 263 of the Therapy for Black Girls podcast. We'll get right into our conversation after a word from our sponsors. Right now, there are millions of people around the world hosting on Airbnb. I mean, there's no doubt it's a great way to earn extra income. I've always wondered about their stuff, though. Like, what happens if somebody drops a wine glass? Now I know. Thanks to Air Cover for Hosts, people can welcome guests into their home with confidence. Air Cover for Hosts gives you damage protection for free every time you host. Learn more and host with peace of mind at airbnb.com/aircoverforhosts. Made with love and seasoning, feed your soul at the Essence Eats Food and Wine Festival, exclusively inside the Essence Festival of Culture. Presented by Coca-Cola, sponsored by Ford and Target. Stay fueled up all weekend for legendary performances, plus new experiences including Dear Black Men and the Essence Tech Summit, sponsored by AT&T, Ford, Google, and McDonald's. It's all happening July 1st to July 3rd in New Orleans at the Essence Festival of Culture. Get your tickets now at essencefestival.com. When my family and I travel for vacation, one of my favorite things to do is to visit the local Whole Foods market to stock up on snacks for our time there. I love visiting Whole Foods markets in new areas because the selection is always so unique. Have you ever noticed the difference between the goodies offered at each store? That's because they put a big emphasis on stocking things from local suppliers. It's another fun way to explore the area you're visiting. Looking for more ways to be well as you enjoy summer fun? Visit wfm.com/wellness for more wellness tips. Although restrictions related to COVID-19 may have lessened around the country, the risk has not gone away. Vaccines have been an important part of protecting our health throughout the pandemic, but so far they haven't been available to children under the age of 5, which has left parents and caregivers in a very difficult position. Last week, the FDA authorized use of the vaccine in this age group, so we can expect administration in this group to start soon. If you're a parent or a caregiver, you probably have lots of questions. Joining me this week to help answer some of these questions is Dr. Nina Ford Johnson. Dr. Johnson is a board-certified pediatrician who has been serving the families of the Mobile, Alabama area for 10 years. With her expertise in serving children of all ages, Dr. Johnson has been a go-to voice for Black children's health during the pandemic. Her recent national campaign, I'm a Mom First, is by moms and for moms who have concerns about vaccinating their children. Our conversation explores what's in the COVID vaccine and how it works, breaking down common concerns and debunking myths around the vaccine, how to identify COVID symptoms at home, and she shares advice to caregivers who might be struggling with the decision to have their children vaccinated. If something resonates with you while enjoying our conversation, please share it with us on social media using the hashtag TBGInSession. Or join us over in the Sister Circle to talk more in depth about the episode. You can join us at community.therapyforblackgirls.com. Here's our conversation. Well, thank you so much for joining us today, Dr. Johnson.
Thank you. I'm so glad to be here. Thank you for just having me.
Yeah, so this is such an important topic, and it feels like there's new information almost every day, right? So I would love for you to get started. I know that when we talk about children, there's lots of anxiety, lots of concerns about perhaps getting your child vaccinated with the COVID-19 vaccination. Can you talk to us a little bit about what the vaccine is and what it does for children?
This is such an important conversation because we are seeing cases starting to uptick a little bit in our children. And so it's so important that we still tell our parents and their family members how important it is for these children to get vaccinated. This COVID vaccine is very safe. It does not have any eggs. It does not have latex. It does not have any preservatives whatsoever. The vaccine, as we call it, is very clean, and it is made with excellent technology by our medical scientists. So we're so proud of this vaccine. This vaccine contains a couple of salts, like magnesium and others. It contains lipids, which allows the vaccine to deliver it very effectively to what it's supposed to. And it contains mRNA, and it does not change the child's DNA. It basically tells the immune cells to protect against the virus, and it allows them to protect against the spike protein. And the spike protein of COVID-19 is what causes this virus to be so virulent and very scary, and it does wreak havoc in our immune systems of our children and adults. And then once the mRNA does what it's supposed to do into the cells, it degrades very rapidly and does not cause any problems. So it does not change the person's DNA at all. It just allows it to be very effective for what it's supposed to do.
So, Dr. Johnson, can you break that down into maybe simpler terms? Because some of the words I understand that what you're saying, but I definitely want to make sure people understand exactly what the vaccine does for the kids.
mRNA is basically as a cousin, we can say, to DNA, which basically genetic code that makes us also different and very special. And so the vaccine basically is encoded into the mRNA, which is basically put in mRNA, which allows it to go into our different cells, which helps us fight different viruses and bacteria and the like. And COVID-19, it produces a protein, and basically this protein is called spike, and it allows the spike protein that COVID-19 produces to attack different cells of the body, which is where we see why COVID-19 has caused a lot of problems with the lungs. So it attacks the lungs. It can attack the heart. It can attack blood vessels. So you'll see a lot of people, especially when COVID-19 first came out, it caused a lot of clots and stuff like that. So it'll attack that system as well. And so what the vaccine does, it causes an antibody, which basically fights that spike protein if someone was to become in contact with COVID-19. So they've already produced an immune response to the virus, even before they've even been introduced to the virus, meaning before they've even got infected with it. So this vaccine is very good, and I hope that helps.
Mm-hmm. It does. It does. So it's basically helping you, like, should you become infected, if you get the vaccine, it helps your body to fight against that infection so that maybe you don't become as sick as you might if you didn't have the vaccine.
That is correct. That is very correct. Thank you.
Got it. Got it. Okay. And so you mentioned that there's no eggs, no latex. So those are some of the common concerns with other vaccinations. And I know that for some of the very early childhood vaccinations, you often hear parents talk about like trying to space them out, or do we give them all at once? Is there any concern with having to space this out, say from your regular flu shot or from other vaccinations that a child might have?
Good question, but no. Again, this vaccine is very good. I've actually given it in conjunction with the flu shot, same day, same time. I've actually given it in conjunction with a child who came in for their yearly checkup and they needed shots. And so for like my 11-year-olds who come in ready to go to middle school and needing those shots to get in, they've actually received that vaccine as well, right along with the other ones, and have done completely fine. So there's no need to space out any of your other vaccines to get that COVID vaccine, or also if you were to get the flu shot when it is flu season, it's okay to get the COVID vaccine right along with it.
Got it. And are there any side effects or risks that you have found or heard about related to the COVID vaccine for kids?
Good question. The main thing that I've seen are fevers. So a fever for like a day or so. And of course, you may get some arm tenderness. It may hurt where the shot was given. And that may happen for a couple days. Another side effects are just chills or feeling more fatigued or tired than usual. Again, those symptoms just usually last 24 to 48 hours, just a couple days. I say take some Motrin, get plenty of liquids, get plenty of rest, like you would with any vaccine, like you would with the flu shot or anything like that. and those usually go away.
Dr. Johnson, I feel like I've heard lots of different information about how COVID actually impacts kids, right? So, and it feels like maybe sometimes that the severity of how sick kids get is different between the different strains, right? And so I know that there's like a new strain, I think, on the horizon. Can you say a little bit about how COVID-19 does show up in kids? Like, is it typically less severe than we see in adults, or, should we be just as concerned about kids being infected with COVID-19 as adults?
You know what? From what I've seen in my office, the symptoms are less severe. So a kid I saw 2 weeks ago just had like a little cold, stuffy nose, barely even had a fever. So that was his symptoms. And so COVID-19 is a virus, so it affects you from head to toe. So headaches, you may get some red eyes, runny nose, sore throat. You may cough, a little vomiting, diarrhea, again, affects you from head to toe. So usually the symptoms that I've seen in my office mainly look like the flu, or may come in looking like a stomach virus because they got a lot of vomiting and diarrhea because of that. Very rarely have I had to admit one of my children who had COVID-19. One did get admitted, but this child had several other chronic ailments and conditions. And so a couple of long-term effects, though, I have seen with kids with COVID, and those have been more so my teenagers, where they've had headaches for long periods of time, or one had issues with her taste, and so couldn't taste or couldn't smell things for like a couple of months, and so lost weight because of that. Fatigue, or they had what we call that brain fog when they couldn't really think through like their schoolwork. So they had to go to homeschool and not do in-person school. So that's been a couple of effects. But I will say this, it is still very, very important for children to get the COVID vaccine, because I believe it was last year, 2020 or 2021, I can't remember the year, but it was the 11th cause of death of children in the United States. So it's still very serious, and it's still very important for children of African American descent to still get the COVID vaccine. Because I hate to say it like this, but this is true. When white people get a cold, Black people get flu or pneumonia. So it does affect us more serious. So our rates are higher for hospitalization and serious illness because of this than other nationalities.
More from my conversation with Dr. Johnson after the break. Did you know that there are millions of people around the world hosting on Airbnb right now? That's a lot of amazing homes that are making people a lot of extra money. And it doesn't have to be an everyday thing. You can host when you want. Like if you're taking a week's vacation, why not host your home? That money could go towards paying for your current vacation, or towards your retirement fund, or even towards your kids' college fund. And listen, if you're worried about your stuff, don't be. Air Cover for Hosts lets hosts welcome guests into their homes without having to worry. You get $1 million in damage protection anytime you're hosting, plus pet damage protection and income loss protection. And ready for this? Air Cover for Hosts is completely free every time you host on Airbnb. Free. With Air Cover for Hosts, it makes hosting a no-brainer, and the benefits really start adding up. So learn more and host with peace of mind at airbnb.com/aircoverforhosts.
Imagine a sharp, stabbing pain on your skin. Sounds like a nightmare, right? While individual experiences may vary, it's how some people describe shingles. This painful, blistering rash could interrupt your life for weeks. It could even force you to cancel social events or weekend plans. Over 99% of adults 50 years or older already carry the virus that causes shingles. 1 in 3 people will get it in their lifetime. Why wait? Ask your doctor or pharmacist about shingles today.
Hey Dad, cool if I change this?
They may not get each other's music, but they can both get a COVID-19 booster shot. Because the CDC recommends booster shots for people 12 years and older after completion of a primary series. Schedule an appointment as soon as you are eligible. Sponsored by BioNTech and Pfizer.
And can you speak to a little bit about why that is?
That's a good question, and we really don't know why. I'll say this, Black women, we've seen COVID affect us pretty hard, and we are more prone to get conditions like lupus and other things like that, other autoimmune problems. And so we're wondering if it's because maybe the clotting system is different. Because when it first came out, we thought we were going to be safe from COVID-19 because majority of us have O positive blood, but that's not true at all. So we really don't know why. We don't know if it's because it's late presentation. Are we coming to our doctors too late to be treated? Is it because the medical system still does not, I'm trying to say this where I won't offend anyone, but still tell the truth, right? And so when we come and when we go to the emergency room and we go to the doctor, it's usually at a last resort, right? We try to do our best at home, take all the medicine and everything we can before we go to our doctor. So is it because we're showing up sicker than usual than we would have if not? And so when this first illness first came out, I told the medical society and the community here locally in Mobile County in Alabama that when your patients arrive to the ER or to your office, believe them when they say that they're sick, because they wouldn't come otherwise. They're not just going to show up just to show up. They're having to take off work. They're having to get to the ER or to their doctor's office the best way they can. And they're not just showing up just because it's something for them to do. They're showing up because they're ill, and you have to take them serious for it.
Mm-hmm. Yeah, I mean, and I think that speaks to the long-standing, like, institutional racism we see in
Correct.
medicine, right? So the misinformation that has existed related to lots of different illnesses and medical experiments, I mean, there's a long history. And so
Yeah,
I know that a lot of that has fed into some of these concerns as well.
definitely, definitely. And so that's why it's so important that what you're doing and what others are doing is putting out correct and right information for our communities to receive.
Mm-hmm. You mentioned a lot of symptoms, Dr. Johnson, and I'm in Georgia. And so all of
Yeah,
this stuff with like runny nose and scratchy throat and all of that also sounds like allergies.
it
And
does.
so I'm wondering, for our kids, should we be using like the COVID-19 at home test to test them if they have any of these symptoms, or should we bring them straight to the doctor's office? Like, how should you proceed with any of these concerns or these symptoms you've mentioned?
You know what? That's a good question. And allergy season is big, right? Especially around this time of the year and sometimes all year round. So if you have to know your children, if you see them like runny nose and cough and congestion, but now they're sleeping more than usual, or they're not eating as much, then that would be the time to either do an at-home test or take them to their doctor to find out what's going on. But especially if they have other past medical problems like asthma or something like that, or even high blood pressure or diabetes, those are the kids who you don't want to play around with, who it will not hurt for them to be seen by their doctor just in case. Because we know that if a child or an adult has other comorbidities like diabetes, high blood pressure, having to use a CPAP because they have sleep apnea, then those are concerns that they need to see their physician quicker than someone who does not have any medical problems at all.
Got it. And Dr. Johnson, what is the latest update about vaccinations for children under 5? So I hear these parents and my heart goes out to them, right? Because it does feel like there's a large segment of our population who just have not had any options. Like, they're too young for the vaccine, and a lot of them are too young even for masks. And so what is the latest update about when we might expect any information about vaccines for kids younger than 5?
Good question, because my 3 are all younger than 5, and so I'm ready for they got to go to school, right? Without delay. So what I've been hearing is that by the end of June is a good possibility that the vaccine will be ready for them. And it's at 80% effective, which is still really good. The COVID vaccine for us adults is around 95%, but I will still take 80% for those 5 and under children. And so as soon as that is available, I do recommend. I was looking at the news and I saw this update while I was in the bed, and I turned over. I said, ooh, well, my kids are going to be first in line, child, because they need that vaccine because they're sick so often. They're exposed to so much. You know, of course, they see me with my mask, but my kids are 3 and they're not even trying to wear a mask. I put it on their face and it's all here or here.
Right.
It's everywhere. So, yeah. So
Yeah.
as soon as it comes out for them, I totally recommend it for those 6 months and older.
Got it. And will it also be 2 doses, or is the dosage changed for children younger than 5?
I think it will be 2 doses, and it may even be 3. So, and I think it's like, you get one, the child gets one, and they come back in about a month and get that second dose. And then we'll see what they say about when the third one should be given. So I think it's at least 2, but it may be 3.
Got it. Got it. We've already talked about some of the concerns around why our community is sometimes hesitant to believe that we should trust vaccines and all of those things. What kinds of information or wisdom would you like to share for parents who might still feel a little hesitant about vaccinating their children?
Yeah, and it's a difficult conversation to have, but a necessary one. And we don't want to just give our children shots just willy-nilly. But these vaccines have been tried and proven, right? We don't see people with smallpox walking around or yellow fever or polio anymore in our modern day society. And so that's because the vaccines work. And so I encourage parents, and there's still parents, even in patients I take care of, who are against it. And they've seen my commercial, right? They've seen me on TV, they've heard me on the radio, and they're still hesitant. But the main thing is I don't try to browbeat them about it. I just encourage the conversation. If they say no today, they may say no the next time. They may say no a year later. We talk about it more often, what kind of concerns they have. So talk to your pediatrician about it and get the right information.
Mm-hmm. Yeah. So, the other thing, Dr. Johnson, is that we are seeing now on the news about monkeypox. Is this something that we should be concerned about? And I don't remember, is there a monkeypox vaccination we get as children?
No, not at all.
No. Okay.
I told the Lord, I said, Lord, I can only take one thing at a time. So luckily, I don't know what's going on with this monkeypox thing. I'm sure we'll get more and more information about it. It's nothing that I've seen in my office or anything yet, nothing that they're warning us against that we need to be out on the lookout for. There's nothing that the state public health department has put out and says, hey, you need to watch out for this and this yet. So when it comes time, we'll be ready. But right now, just have parents just concentrate on this, and then we'll move on to the next thing, because there's always a next thing.
Mm-hmm. Yeah, understandable. So what other vaccines do we get, though, as kids? I feel like, I have 2 young ones, and so I don't remember all of what they've gotten or what all I got as a kid. So what other vaccines are kids typically getting, like, their shots for school, so to speak?
Whooping cough, polio vaccine. Again, I was telling somebody, like, the last time I saw somebody with polio was my great aunt Flossie. It was a beautiful woman, but she had one leg that was shorter than the other because she had polio. But that's something that we protect against. Chickenpox. I had chickenpox as a child, but they didn't have the vaccine available. And so my sister, who is 8 years younger than me, she's never had chickenpox because she's had the vaccine. And so we like to vaccinate against different strands of hepatitis, which is an infection of the liver that is caused by a virus. And that can be given to people or children by something as simple as eating something that is not cooked properly. And so that's something we like to protect against as well. And there's numerous other bacteria we protect against that can cause pneumonia and meningitis. Pneumonia is an infection of the lungs, and meningitis is an infection of the brain. So we protect against that for children and our teenagers, especially the ones who are going off to high school and college, as they start living in those close communities and quarters where it's more easily to catch something than another child who may not be living with their classmates. There are a number of vaccines and stuff that we protect our children against, but it's very necessary.
Mm-hmm. Thank you for that, Dr. Johnson. More from my conversation with Dr. Johnson after the break. Did you know that there are millions of people around the world hosting on Airbnb right now? That's a lot of amazing homes that are making people a lot of extra money. And it doesn't have to be an everyday thing. You can host when you want. Like if you're taking a week's vacation, why not host your home? That money could go towards paying for your current vacation, or towards your retirement fund, or even towards your kids' college fund. And listen, if you're worried about your stuff, don't be. Air Cover for Hosts lets hosts welcome guests into their homes without having to worry. You get $1 million in damage protection anytime you're hosting, plus pet damage protection and income loss protection. And ready for this? Air Cover for Hosts is completely free every time you host on Airbnb. Free. With Air Cover for Hosts, it makes hosting a no-brainer, and the benefits really start adding up. So learn more and host with peace of mind at airbnb.com/aircoverforhosts.
Imagine the feeling of pulsing electric shocks. Sounds like a nightmare, right? While individual experiences may vary, it's how some people describe shingles. This painful blistering rash could interrupt your life for weeks. It could even force you to cancel social events or weekend plans. Over 99% of adults 50 years or older already carry the virus that causes shingles. 1 in 3 people will get it in their lifetime. Why wait? Ask your doctor or pharmacist about shingles today.
Hey Dad, cool if I change this?
They may not get each other's music, but they can both get a COVID-19 booster shot. Because the CDC recommends booster shots for people 12 years and older after completion of a primary series. Schedule an appointment as soon as you are eligible. Sponsored by BioNTech and Pfizer.
The other conversation that I think that has been happening in parallel to the conversation around vaccines is also the mental health toll that this has taken on our kids. There's lots of new research coming out talking about anxiety getting higher in kids. We do see, sadly, an increase in youth suicide rates. And so can you talk a little bit about some of the mental health impact we've seen from the pandemic on children?
Yeah, and it's been really challenging, especially the anxiety portion of it that we're seeing. I'm having kids who are in elementary school having issues dealing with going out in public now, to the point where they don't like to go to the store. They just want to stay at home, and parents are having to homeschool them. They are actually saying like their stomach hurts. Their mental health problems is now becoming more somatic, meaning they're blaming it on a headache, or they're having issues with their stomach and having to see different specialists, and the specialist telling them, hey, your stomach is totally fine, but it's all up here. And so the main thing I tell with parents is to have real conversations with your children and be upfront. Even if you have anxieties or something that makes you concerned or nervous yourself, say, hey, I understand what you're feeling, because mommy is also feeling a little concerned about this as well. But as your mother, as your parent, that is my job to take care of you 100%. So you don't have to worry about that. And so seeing the anxiety portion has been very concerning. And there have been some uptick in depression. And some of the depression, I think, has to deal with loss of family members. So I have several kids who are now orphans because of the COVID. And so you have to talk about these mental health issues in our children, but also in some of these surviving parents, because I've had children who've lost grandparents due to COVID, and that was their primary caregiver. So it's been very challenging these past couple of years having to navigate the system where, as you know, Dr. Joy, it's not funded as well, especially in our communities, giving them the resources that they need to be successful in terms of that. Because the mental health portion plays such a key part in their academics and also their physical well-being.
You talked about, the loss of family members, but I think a lot of kids also like the loss of social interaction. There was a time they weren't back in school or they were doing virtual school, right? And so I think the loss of just like hanging out with their friends and all of that has led to maybe some increase in depression and anxiety.
Definitely. And how they just miss a hug. Mm-hmm. I took my kids to Disney World at the end of last year, and they couldn't give Mickey Mouse a hug. It's really just the small thing.
Mm-hmm. So I know that you are a pediatrician by training, and so mostly you see the little people, but you also come into contact with their parents, right? When parents are bringing. And so what kinds of conversations have you been having with parents about their own mental health? Because that has been a huge toll as well.
It's so important, especially my moms who just had babies. And so you have postpartum depression, and we're talking about that. And so then you're wondering, like in the height of COVID, well, could my child get COVID because they're at daycare? I also make sure that my parents And my grandparents are staying on top of their physical health in terms of making sure they're getting their annual checkups. Don't forget your mammograms. Don't forget your colonoscopies. All those other things that sometimes gets put off because of COVID. They don't want to go to the doctor because they're scared they're going to get COVID.
Yeah, all that has been very real. It has felt very hard, I think, to make some of those decisions. And I think that's where some of the frustration has come, is that it doesn't feel like there was a largely like solid messaging in place to help people figure out how to like determine their risk around certain things.
Exactly. Exactly. And so that's why it's still so important that they hear, because people are still dying from heart attacks. They're still dying from strokes. Kids now more than ever, especially at home, we're seeing what the COVID-15, the COVID 20 pounds more because they're eating so much. So we're still seeing diabetes and high blood pressure in our children. So it's still something that even though we may be in a pandemic or hopefully starting to inch our way out of it, you can exercise, you can go outside, get some of that vitamin D.
So you bring up another good point around people have different opinions around vaccinations for kids. And I think that this has caused some tension, I think, even in families. Let's say you have a sister who has kids that she doesn't plan to vaccinate. Like, is it still okay for them to have play dates with other people who are not vaccinated? Can you give us some guidelines around how we should move forward with kids in terms of maybe interacting with other kids who may not be vaccinated, or how do we make some decisions around that?
And that can be tough because you don't want to shelter your own children, right? You can ask the parent, are they having any symptoms, any cough, runny nose? Do your activities outside instead of in a confined space. So at a park where everybody's running around and doing everything like that. Like I said, just plant the seed. And if they don't accept it, and that's okay, because at least you did what you thought was right. If they know we're coming from a good place, then I think people will be more apt to receive it.
That's helpful. Thank you for that. So are there considerations or things we should be thinking about in preparation for, I know one school year just ended, maybe not even for some people, right? But in thinking about going back to school in August, are there things we should be thinking about in terms of talking with teachers around like mitigating risks? Are there any things that you suggest for that?
We still keep up that good hand hygiene. We still got to wash our hands. We still have to make sure we keep our hands out of our face and out of our mouths. Even as adults, we still have to do that. The child shot records and all that stuff is up to date. You want to encourage your kids to make sure they're seen by their physician for their annual checkup. So we can talk about even school readiness, right? Every time I see a kid come in for an office visit, whether they're sick or well, I always ask them how they're doing in school. Because to me, that shows such an important part, how their physical and their mental health is doing, is how are they doing in school. And so we can talk about things like, are they having issues with attention? Or how do you feel their reading comprehension is doing, or their math, or their handwriting skills and stuff like that. So that's something to be addressed. And then we can also, their speech. So that way, like during the summer, we can send them to speech therapy or occupational therapy or even behavioral therapy, so we can work on some of those attention and focusing things, so we can get the ball rolling during the summer so they can make progress. So by the time school year starts, they'll be ready or on a better foot than they were before they ended the school year.
Mm-hmm. Thank you. So Dr. Johnson, can you tell us a little bit about your educational background and your pathway to the work that you do now?
Yeah, thank you. My family's in Atlanta. I'm a graduate of Stone Mountain High School. And then I went to Tennessee State in Nashville, where I did my bachelor's degree in biological sciences. And then I graduated from Harry Medical College, which is right down the street in Nashville, where I got my medical doctorate. So 2 outstanding historically Black college and universities that I really hold dear to my heart. And then I did my pediatric training at Baylor College of Medicine in Houston, Texas. And now I've been practicing in Mobile, Alabama. They also call it LA, Lower Alabama. And I'm glad to be here.
So I'm curious to just hear how being a pediatrician has changed for you 5 years ago versus what your practice looks like now. Like, what has that change look like?
I'm definitely more busy, but I'm grateful for it. I've got more gray, so I have more wisdom. my patients and my parents take me a little bit more serious. And then it also helps that over the past, 3 years now, going on 4, I became a mom. And so I think parents appreciate that perspective because now I can give them some tips on what I've done and some things that I was dead set on, stop the bottle at 1 year of age and stop that pacifier at 1 year of age. Now I can tell them what happened for me and my kids and how it was a little bit different. And so definitely more understanding to the plight of parents.
And what is it that you do? Do you have a private practice in Mobile or are you doing something else?
Yeah, I work with 3 other great pediatricians in a group practice in Mobile, Alabama. We don't see any hospitalized kids. We used to before a certain period of time, about 4 or 5 years ago we did, but we cut that out of our practice. So now we just see our patients totally in the office.
Thank you, Dr. Johnson. And where can people find you? Do you have a website you'd like to share? And are you on any social media?
Yeah, I am not really on Instagram. I am somewhat on Twitter, definitely more on Facebook, but slacked off in the past couple of months just because kids and life has just gotten so busy. But Dr. Nina FJ on Twitter and Nina Ford Johnson on Facebook.
And your practice website.
Oh, yes. So actually, we're just on Facebook. We're Infirmary Pediatrics, and that's where our practice is.
Got it. Well, thank you so much, Dr. Johnson. It's been such a pleasure to chat with you.
Yes, and thank you for dealing with me and my voice. My kids gave me something called RSV, which causes a lot of coughing and wheezing. And so thank you for the good work that you do.
Thank you. I'm so glad Dr. Johnson was able to share her expertise with us today. To learn more about her and her work, be sure to visit the show notes at therapyforblackgirls.com/session263. And be sure to text 2 of your girls and tell them to check out this episode right now. If you're looking for a therapist in your area, be sure to check out our therapist directory at therapyforblackgirls.com/directory. And if you want to continue digging into this topic or just be in community with other sisters, come on over and join us in the Sister Circle. It's our cozy corner of the internet designed just for Black women. You can join us at community.therapyforblackgirls.com. This episode was produced by Frida Lucas and Elise Ellis, and editing was done by Dennison Bradford. Thank y'all so much for joining me again this week. I look forward to continuing this conversation with you all real soon. Take good care. Right now, there are millions of people around the world hosting on Airbnb. I mean, there's no doubt it's a great way to earn extra income. I've always wondered about their stuff, though. Like, what happens if somebody drops a wine glass? Now I know. Thanks to Air Cover for Hosts, people can welcome guests into their home with confidence. Air Cover for Hosts gives you damage protection for free every time you host. Learn more and host with peace of mind at airbnb.com/aircoverforhosts. All of Maui Moisture vegan hair care products are made with 100% aloe vera as the first ingredient to hydrate hair across the curl spectrum. They have everything you need for wash day and beyond. Some of the best-selling products include the Heal and Hydrate Shea Butter Shampoo and Conditioner and the new Nourish and Moisture Coconut Milk Curl Foam Mousse. The Maui Moisture products are all under $10 and available at your local drugstores. Visit tiny.cc/Maui Moisture on Amazon to receive 15% off select Maui Moisture products. Ends June 26, 2022.